Hello, I'm JG Hotshire, President, Chief Executive Officer, and I'm excited to come to you today with just a short, very short update on some exciting things that are happening out at our clinics. So first, let me start by sharing the news with you that from time to time, our providers decide to either retire, resign, or otherwise get out of the industry. And we've experienced that over the last 5 years here at Hillsdale. Individuals that retire, great men and women who have worked very, very tirelessly for our community. I think about Dr. Bediako in his decades of years of service. I think about Dr. Buachi. I think about Dr. Lusty, and the list goes on and on. Individuals who have contributed to the overall health of our community and of this hospital. And it's always a saddened time for me whenever a provider comes in and says they're retiring. It just happened not too long ago. We had Dr. Bidney, a podiatrist, come in and say, I'm retiring. And I always think as a chief executive officer that day's never going to happen. I'm going to have these doctors, because they've been here, after all, for decades to come. But there's a part of me that, as selfish as that is, I have to recognize that they need their retirement life. They need the opportunity to live the rest of their life enjoying things that they couldn't enjoy because they've dedicated themselves to 24/7 coverage of hospitals like ours. And let me tell you something, rural medicine is much different than urban medicine. The call coverage requirements of our team members far exceeds that of other hospitals. Even in rural communities like ours, we're unique. We have a great team of professionals. But from time to time, individuals, whether it was a spouse who decides to leave to another area and take a job, or if they want to move into a new community because they want the better school districts or whatever it is for them, we do lose providers. And I wish I could change that and say, no, we want to keep them right here at Hillsdale. That'd be selfish, much like the retirees. So we have to accept those situations when they arise, but we have an opportunity to respond to that. And our opportunity is to make sure that we have seamless coverage for our patients. That's you. Every time that you need an appointment, to provide access. And that's something since my administration that I have worked aggressively on, to make sure that access points are quick for our patients who need appointments. And in many cases, whether it's primary care or specialty care, there was a time here at our hospital where an individual would wait months and months to get specialty appointments. We have brought new services here to ensure that our community can receive those services right here. I think about neurosurgery. I think about vascular surgery. I'm thinking about specialized orthopedic care. I'm thinking about obstetrics. In communities across the country right now, they're closing a lot of these service lines down. In rural hospitals, they don't even see these types of services. So we are dedicated to providing these services for you. Limit your travel in your backyard, get back to your business, and you support our health system, which generates revenue back to support our community. The donations we make, the contributions are endless. The number of requests that we receive each year for providing food for food pantries. All those things are very important to us, but we cannot achieve that without you and your trust. So our commitment to you is to ensure that we have providers that are in place who can get you in timely, and can build that relationship when someone's resigned or otherwise left the organization. And so my commitment to you is that we had a recent departure of several of our providers for a variety of reasons. Some retirement, others have left the community. And so we have replaced them. And in a market that we exist in today, it is sometimes hard to find replacements, but we have been aggressive at finding qualified, highly skilled, and well-known providers, and I'm going to share with you in just a minute who they are, to some of our clinics. Now, when we look at our clinics, primary care clinics really comprise the majority of our outpatient services because we do own quite a few of those centers. When we think about some of the strategic direction of this hospital, we have purchased practices. If you think about Dr. Garrett's practice at Hillsdale Health and Wellness, we have purchased that practice and incorporated that as part of the Hillsdale family. Other practices we've purchased, up to and just most recently, Hillsdale Medical Associates. And we are encouraging our patients to stay on board with us. That is the opportunity for you, is that your record is still there. Your opportunity to be served in the same capacity with the same services remains the same. Little to no interruption should be felt by you as a provider. Now, leaving. Now, it is hard because our provider that we have a relationship does leave, so you do have to build a new relationship. But we're bringing you two great individuals who are fantastic human beings as well as providers. It is my pleasure to introduce to you first Patricia Wise. Now, Patricia's been with us now for almost 2 months, and she is out at Hillsdale Medical Associates, and she is doing a phenomenal job for us out there, working in collaboration with Dr. McCants, Dr. Baker, and other providers. Now, Patricia, let me just give you a little background on Patricia. She graduated Idaho State University's PA program in 2010. So for nearly 15 years, she's been practicing in a variety of areas. She has a lot of depth in oncology and other areas of specialty, so she brings a vast amount of education, experience, and hands-on practice to rural communities like Hillsdale. And so we are so excited. I've received numerous comment cards from our community just praising the work that she has done. She is excited to join us in primary care where her main focus will be. But for those complex patients, what we would call high acuity patients, she's able to see you. And she's taking appointments. And we're going to make sure that if you have a need to see primary care, that we will get you in to see Patricia Wise. Now, we also have another candidate that I'm excited to introduce to you, and he's certainly someone that we have seen before in our community and someone who was well loved. And his name is Brandon Douglas. Now, Brandon was in our community years ago and spent a good deal of his time building many relationships. And I would always hear in the community, Brandon. And when we had the opportunity to meet with him recently and had an opportunity to offer him employment and reach that agreement, it was a glorious time to celebrate for us, for both him and Hillsdale. It's a homecoming for him, and it's a victory for our community because he is well loved in primary care and has a vast amount of experience working in that field. And so a little bit of background drop on Brandon. He's from a local guy, Jerome, Michigan. So right here in our community. And the one thing that really makes me very, very proud is when we can say there's been a homecoming. And we look at Dr. Odell, we look at Dr. Spencer, we look at some of these folks who have lived their lives in Hillsdale, went to medical school, but now are coming back. And it's really encouraging to be able to welcome someone like Brandon on that list as well. So born, raised, Jerome, Michigan. So very deep roots in our community. He serves as what's called a physician's assistant. So he went through a PA program at Kettering College of Medical Arts, and his entire career has really spanned around family practice and working with patients. Now, he has some experience in dermatology. He's done some procedures in dermatology. He does his patient evaluations, follow-throughs, script orders, multidisciplinary teams, you name it, he's done it. He's worked in palliative care, just a tremendous, well-rounded physician's assistant who we're excited to have join our practice out at Hillsdale Medical Associates. So both of these providers will have additional announcements here in the very near future. Complete and round out that program at Hillsdale Medical Associates. We'll be announcing here in the future someone else is going to come in to provide some support services. I'm not ready to make that announcement yet, but I want you to welcome with me to our community Patricia Wise and Brandon Douglas, both of them well-known, well-respected, and you will find great enjoyment in speaking with them and having them serve as your primary care provider. If you're looking for an appointment, you can do that on our website, hillsdalehospital.com/primary care. There you can learn all of our specialty areas, but in primary care, you can see who's accepting patients, what type of credential do they have, where are their practices located, all of that important information. Scheduling your appointments is very easy, 517-439-0200. So if you're looking for an appointment at Hillsdale Medical Associates, that's again Dr. Dan McCants' practice that now we own as Hillsdale Hospital in partnership with Dr. McCants, as well as Dr. Baker and Dr. Shaw, all of them working collaboratively with Hillsdale Hospital to provide superior care for our community. So if you want to book your new patient experience, you can do that. If you're looking to switch and you want to provide your information to us, we'll be more than glad to get you on our appointment schedule and bring you into one of our clinics that may serve your needs in a community in which you live. Maybe you're in Reading, Michigan. We have a clinic there. Maybe you're in Jonesville and it's closer to go to a Hillsdale office. Whatever it is, we want to serve you, our community. So thank you so much for taking the time today to learn about two new providers. I'm excited to welcome them in the studio eventually on one of our live events and maybe even on radio. But until then, remember, Hillsdale Hospital here for you each and every day to ensure that we provide those services that you need to keep you right here. You don't have to travel, providing back to our community the services and the resources to be able to sustain this hospital for over another 100 years, hopefully. So until I see you again, stay safe, stay healthy, and stay Hillsdale strong when you choose Hillsdale first.